Hey guys, Dr. Norm. I was going to shoot this video from my morning hike, but it's looking a little overcast today, so we're coming to you from the backyard, and yes, it is mango season right now. Wanted to talk about a topic you guys are going to run into a lot. Patients who want a la carte chiropractic. Let me explain what I mean by that. Sometimes you'll have a patient come in who says they've been to a chiropractor their whole life and they want to get adjusted, a certain way, or they only want a certain segment adjusted, or, whatever it is that they're asking for. They're essentially stealing the authority from you, the doctor, and saying, here's what I want, do A, B, and C, and I don't care about your analysis, and, trust me, I've been going to the chiropractor forever. While there is good information in that, knowing what past chiropractors have done on this patient, or knowing what this patient thinks works for them, is fine, but that doesn't absolve you from actually doing your full analysis and sticking to your technique. The example that brought this to mind, last week I had a patient come in and she said, I don't want any manual adjusting, I only want instrument adjusting. I said, well, I don't do that. And she said, well, manual adjusting doesn't work for me. And while that may be true in her mind, or maybe the manual adjusting she's had in the past didn't quote-unquote work for her, I had to stick to my guns. I don't do instrument adjusting. So some of your professors or some other chiropractors may make the case that you need a lot of things in your bag of tricks. You need to be proficient at upper cervical and at full spine and at instrument and at soft tissue and at extremities and all of these things. That's going to be up to you. Whatever you decide your technique is, stick to that. And if your technique is limited, if there's a certain amount of people that you can't help, then you need to question whether you should be doing that technique anyway. In my mind, this patient needed a full analysis, and she needed, then after that analysis, she might have needed an adjustment. All she wanted to do was come in and say, I hurt here, fix me this way that I've had in the past, and don't do what you do. That's not what I do. What I do is I analyze the patient, I find out where the subluxation is, and I fix it. And if that's not something she wants, well, then she can go somewhere else, and that's what I told her. I mean, I was polite about it. I said, sorry, I don't do instrument adjusting, I adjust my hand. And she was like, okay, thank you, and then she left. And I'm okay with that. I'm okay with letting this patient walk out the door because I'm confident in my technique, I'm confident in my analysis, I'm confident in my philosophy. So as you guys are developing, you're trying to figure out which technique you want to do, don't stick to a technique just because it's a brand name technique. Question the technique and find out, is this something that I'm comfortable doing? Once you've figured out, here's how I want to practice, don't let patients come in and dictate that to you. Don't let them come in and say, I want A, B, and C, so you need to provide that for me. No, I'm the doctor, and I'm going to see if you truly do need A, B, and C, and you might. And if that's the case, I'll give you A, B, and C, if that's what I give. So don't let patients walk all over you. Don't let patients dictate the care. You're the doctor, they're not the doctor. Okay, any questions, leave them below, and I'll talk to you soon.